If you are diabetic or pre-diabetic and you need diabetic services, but you need to make your dollar stretch no further than the Maria Holder Diabetes Center. For vascular, podiatry and diabetic eye screening services or consultations with diabetes doctors and nurses, call 417-0305 today. The Maria Holder Diabetes Center, located in Warren, St. Michael. They can save your life and save you money. But members get 10% off.
Get ready for a wonderful Wednesday afternoon.
It will be splendid for us.
As it's time for 15 diabetic-friendly minutes on 100.7 QFM, all with the compliments of the Barbados Diabetes Foundation, the Barbados Diabetic Eye Screening Program, and the Maria Holder Diabetes Center. Good afternoon, Q family. I hope you all recover from crop over. This is Peter Boyce here, and I am here to remind you today about the benefits of visiting the Maria Holder Diabetes Center.
I would like to hear some more about the center.
Okay, I'm glad you asked. The Maria Holder Diabetes Center is an institution dedicated to the management of diabetes in Barbados and preventative care for all Barbadians. It offers a multidisciplinary approach to diabetes care, which is a concept that is new to Barbados, where patients can be seen by diabetes specialist physicians like Dr. Diane Brathwaite, specialist nurses like Nurse Tracy, nutritionists like Victoria Cox, all at the same visit in a holistic exercise. Well, if I want to get my foot tender. The center also houses a foot care clinic, which is run by podiatry specialist Louise Robinson, so they have everything covered in this one location, and Louise works in tandem with the rest of the team. Other services offered by the center are eye screening for diabetic retinopathy and vascular screening for venous insufficiency, or what Bajans refer to as bad circulation. Patient empowerment and self-management are the central focus of each encounter, with the whole patient approach to medical care.
Excuse me, I have a question.
Go ahead.
Exactly what is the whole patient approach to medical care? I would like a further explanation of that.
I'm glad you asked that, because right about now we're going to bring into the program diabetes specialist Dr. Diane Brathwaite to tell us about whole patient medical care.
Hello, good day, Peter.
Good afternoon, Dr. Brathwaite.
Alfonso.
Hi, Dr. D. You call my name first, man. Hold against you.
And to everybody out there who's listening in to us, we hope that you had an enjoyable and a safe crop over. Alfonso, are you still standing? Last man standing?
Still standing and walking up.
But hope you enjoyed everything, and I hope the both of you managed Golden Soca well. I heard it was such a great show. I unfortunately wasn't able to attend this year, but I'm just glad that it came off so well. So congratulations to the team of Peter and Alfonso.
Thanks, Dr. D. Try and make sure I come next year here.
So today I've been asked to talk about, interestingly, holistic approaches to diabetes management. And I think it's a great topic, really. And so what that really means is, you just don't treat a patient who's living with diabetes as if you're just treating a blood sugar. You have to really look at the whole person, which means that care has to be individualized and it has to be tailored towards that person. That's why we always say that the patient is the center of the care, and the patient ultimately should be the decision maker as to what they're going to do, but they make those decisions with your support, with informed care, basically. Okay, so what we want to think about with the person is, first of all, looking at the person. Do they require very tight diabetes control? Does their control need to be a little bit looser? Maybe they're elderly and they live at home. So we decide on individual targets for the person. That would be an individual target, maybe for the A1C, and maybe even for the blood sugars as they check them day to day, whether it be a fasting blood sugar, whether it be a blood sugar that's done 2 hours after a meal, etc. So people have individual targets, and remember, what suits Jack doesn't necessarily suit Mary. So if you're living with diabetes, don't necessarily try to enforce what you're doing on somebody else, because your two bodies are very different and your targets might be slightly different as well. I mean, there are general principles, of course, like we know nutrition, leave out all the sugary beverages, the sweet foods and that kind of stuff, mind your portions. But there are other little modifications decisions that people might need to make between themselves. We also want to think about, remember, diabetes management is not just about diet, although I always say diet is everything because you are what you eat. It's very hard to get good diabetes control if you're not eating healthy or in a balanced way. But you also want to think about things like physical activity. What kind of physical activity is going to suit the person? Are you able to get up and walk? Can you walk quickly? Can you maybe break into a jog sometimes? Or are you somebody who really can't handle the walking? Maybe it might be a bad back or some bad knees. Some people may not enjoy walking. There's some people who prefer to garden rather than walk, or they prefer to dance. For some people, swimming might be better because it takes the weight off of the joints. Okay, so it's finding a physical activity that works for the person. Suppose that person is in a wheelchair or they've had a stroke. Is it possible to do upper body exercises? So we have to think about these things when we think about the person, what suits the person. But remember, I'm calling out some key things. We've talked a little bit about nutrition, physical activity. Then you want to think about emotional factors as well. Okay, is this person in a good state of mind? Are they suffering from distress for any reason, or maybe depression, or maybe anxiety? So these are things that all have to be addressed, because when you have a person who's overly stressed out, they're not going to be paying attention necessarily to diabetes. They may forget to take their medication because they're not focusing or they're not concentrating. And so therefore, there has to be this holistic approach towards managing diabetes. I like to think of it towards managing life. If you know that you're, say for example, somebody who's a worrier or stresses easily, are you putting into place some techniques so that you can be more relaxed? Maybe some meditation. Are you taking a few minutes out for yourself every day to center and ground yourself and to put yourself in a positive frame of mind? Okay, so remember, you are a whole person and you're living with diabetes, but you are not diabetes. Don't forget, if you're living with diabetes, high blood pressure is extremely common in persons who have diabetes or pre-diabetes. Make sure you know your numbers. Make sure your blood pressure is controlled. Blood pressure management is obviously a part of the care that we deliver at the Diabetes Center because it is so common in our population. Is your cholesterol profile controlled? Okay. And what if you have diabetes, but then you have maybe an issue with the heart? Is your issue with your heart stable? Remember, everything works together. So at the center, we focus on your whole body, the whole you, the physical and the mental you, and then work on seeing how we can cater towards you, the individual. But that's also your job as well at home, is to figure out, how do I tend to all of these different needs that I as a human being have? How do I draw boundaries for myself? How do I take care of myself? How do I block out time from work so that I can take care of myself? We find that a lot of persons who are middle-aged, they sacrifice almost everything that they have and they are for work, and they neglect their health in preference for work. But that's not a right approach, because obviously it means by the time you retire, you may have so many medical problems because you've not really tended to things properly. You then can't enjoy your retirement. So remember, you are a whole person and the whole of you matters. And of course, sleep and rest. This is something I've had to teach myself. R&R is a critical part of life, and you have to figure out how to create space for that and how to put tools into place to make sure that you're getting enough rest with your busy lifestyles. So thank you so much for listening to me today, and I just want to highlight once again the importance of regular diabetes screening, blood pressure screening, and cholesterol checks. When last have you had a diabetes screening? If you are over the age of 35 or under the age of 35 and you're living with a family history of diabetes or other risk factors for diabetes, such as polycystic kidney disease, or maybe mommy had diabetes during pregnancy, that's called gestational diabetes, or maybe you're under 35 but you have high blood pressure and high cholesterol, or maybe you put on weight suddenly. Remember, early diagnosis is what is going to give you the best chance of remission, very tight control, and having a good, what we call, legacy for diabetes care if you're not able to get rid of it. People who diagnose and control their diabetes very early and control it well are much less likely to have complications than if it goes undiagnosed or is poorly controlled. Take care of yourselves, and my word to you is, remember that you are special. Sometimes you have to learn how to put yourself first. Bye.
Bye, Dr. D. I am sure all the Q family feels special after hearing that piece on whole patient medical care on the best treatment, which is now available at the Maria Holder Diabetes Center. As we go into our Q song of the day, this is the late Tina Turner with Simply the Best. Compliments, the Maria Holder Diabetes Center.
I call you, I need you, my heart's on fire. You come to me wild and wild. You come to me, give me everything I need. Give me a lifetime of promises and a world of dreams. Speak the language of love like you know what it means. And it can't be wrong. Take my heart and make it strong. You're simply the best. Better than all the rest. Better than anyone.
My word to you this weekend is remember that you are special. Sometimes you have to learn how to put yourself first.
I hang on every word you say.
The Maria Holder Diabetes Center.
Baby, I would rather be dead. In your heart, since the start of every night and every day. In your eyes, I get lost, I get washed away. Just as long as I'm here in your arms, I could be in no better place. You're simply the best.
The Maria Holder Diabetes Center.
We welcome to the show Dr. Diane Brathwaite.
I have here with me Miss Charmaine. I'm smart. I was so impressed with her success at changing things around for herself. I begged her just to say a few words to us. Can you just share with us basically how you achieved such success?
I just decided to change my diet. The first thing is the acceptance that you have the diabetes, and I just changed my diet, and that was it. Cut out the flours, the starches, just strictly veg and salads, and I don't use sugar, period, in liquids, just water. Drink my teas and things without sugar, and that was it. But it's commitment.
Yeah, and how do you feel now that your blood sugars are well controlled as opposed to when you came? How do you feel differently?
A little healthier, a little lighter. With the breathing and stuff. So it really feel a lot different.
Okay, and how did you find the program at the center? How is it to you?
Excellent treatment from top to bottom, of total checkup all around. Everybody, staff pleasant and everything.
Okay.
So
you feel like you really know what to do so you can continue to be on the path to success?
Yes, I absolutely.
Okay, so once again, congrats, Charmaine. You did amazing, and we want to encourage everybody else out there in Barbados just to get on board with making sure you keep your diabetes controlled so you can prevent the complications of diabetes. Thank you.
Yeah, thank you too.
If you are diabetic or pre-diabetic and listening to QFM right now, in 2025, Q stands for Quality Health Services at lower prices, which is what you will find at the Maria Holder Diabetes Center located in Warren St. Michael. If you are looking for diabetic eye screening, vascular screening, podiatry, or nutritional advice, call 243-3937 or 417-0305 and make an appointment today. Don't miss next week when we will be dealing with more diabetic issues. Same Q time, same Q station. Compliments, the Maria Holder Diabetes Center, the Barbados Diabetic Eye Screening Program, and the Barbados Community Foundation.
If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier to reverse diabetes, certainly control it properly and avoid complications if you at least know that you have it.
But it's just again to re-emphasize the importance of good diabetic care. And diabetic care involves really almost every part of the body. So it's your feet, your heart. But again, we're coming back to what our main focus is at this time is the eye care.